Hello everyone, I'm Chiara Bellocchi. I'm here on behalf of EUSTAR Young Investigators. We are at ACR 2024 in Washington DC, and today I'm with Professor Yannick Allanore. So Professor, my question is for you about autoantibodies. What is their role to stratificate patients in systemic sclerosis?
It's a good point, a good question, because the more we are working on systemic sclerosis, the more we are realizing its heterogeneity. And of course, it's a challenge for the management, for the treatment, for the follow-up, and we need to improve the stratification of these patients. So we have been living for many, many years with the cutaneous stratification, limited, diffuse, and serous scleroderma. But I see more and more projects looking at the value of the autoantibodies to replace this stratification or improve the, in addition to what can be seen in the skin. So with EUSTAR, we published last year a nice project to compare a stratification based on autoantibodies versus the skin subsets, and we observed that for many aspects of the disease, it was more accurate for the prediction of the outcomes to use the autoantibodies. And so I think we will use more and more this biomarker to stratify the patient, and at the Congress we will show some data, for example, in a very small subset that are the antifibrillary, which are also showing some very specific phenotype and profile. But for sure, autoantibodies are simple to determine. The reproducibility is very good. It's worldwide diffused, and I'm sure we will use more and more there in the future for the stratification of the patients.
Yeah, especially in the early phase of diagnosis.
Particularly in the early phase, and also probably for treatment. You know, there are some preliminary data to show, for example, that the response to tocilizumab is better in the anti-topo population. So I'm sure this simple biomarker will be more and more used in the future.
Thank you very much.
Thank you.